dermatologist, cosmetologist, and a trichologist at both these institutions. And today I am going to be talking on the Baby Chakra app about one of the most sought after problems that women face post pregnancy, which is post pregnancy hair fall. So, for those of you who don't know me at all or have missed the last 2 seconds of the introduction, I work in Bangalore in Manipal Hospitals and Columbia Asia Hospitals. And you can contact me through finding me online or can find links on my Instagram handle, which is at Dr Sravya Says. So here we are to talk about post-pregnancy hair fall today. So I'm going to start off by introducing what it's actually called medically. It's called postpartum telogen effluvium. Now, telogen effluvium is that kind of hair fall which is reversible. So, what causes this post-pregnancy hair fall? it it occurs in any shock to the system. Like these days, most people are seeing it post COVID also. So this is also called telogen effluvium. It's not just post pregnancy that this happens. It happens after any severe viral fever of the body. It could be dengue, it could be typhoid, it could be COVID, or it could be childbirth. So all of them come under the same umbrella of this category of hair loss called telogen effluvium. So why does this happen? After some shock to the system, the patient observes that they have excess hair fall within 2 to 4 months after the incident. So, for example, if you gave birth in, say, May, June, July, August onwards, August, September onwards is when your hair fall would start. It would last and recover within a period of 6 to 9 months if it is recovering naturally and does not require any intervention majorly by a dermatologist. Now, what happens in this kind of hair fall? How do you know that you're having this kind of hair fall? 2 to 4 months after your pregnancy or after you deliver the baby. During pregnancy, your hair is very, very beautiful. It's luscious, it's thick because it's all held together by the uterine hormones, which is estrogen and progesterone. So, what happens suddenly when this influence is taken away and the hormones are coming back to normal in the 1 year post pregnancy is what causes the hair fall as well. So normal hair fall per day is 100 to 150. Everybody knows that. Nobody does not have any hair fall. Whenever you comb your hair, whenever you wash your hair, you see a little amount of hair fall, which is a normal hair cycle. Dead hair or old hair is shed and new hair comes back. So there's no surprise about that. That is about 100 to 150 a day in women. Now, this stops in pregnancy. If you actually observe in pregnancy, you have minimal hair loss. So basically, think of it as like 9 months, no hair loss has been experienced, and all of it falls out all at once because the hair cycle is trying to reset itself post pregnancy. This is why this kind of hair loss is called paradoxical hair loss. What does paradoxical hair loss mean? It means that along with the falling of the hair, this shedding is actually a sign of hair regrowth in women. So, as the new hair is coming out, it is pushing out the dead hair. Hence, you will see a fringe of new hair and very small flyaways all over your scalp. This is the new hair that is coming up. Now, because this is short in length and not so thick yet, it's not transformed into an adult hair yet, you are unable to probably see it as thickness or you were only experiencing diffuse thinning on the scalp. Most patients come very, very distressed, crying or on the verge of crying. Some of them are already in depression because they think they're going bald, which they never will. So be assured that you will never go bald. Men are blessed with that, females are not. So you'll never go bald except in very, very few cases as far as dermatology is concerned. So what do you do? What happens? So the hair sheds. Be very cautious about how you handle your scalp. Be very gentle with it. No excessive combing, no vigorous brushing, no scalp massage whatsoever. Okay. No oil massages. A lot of people in India tend to find coconut oil as the one and only solution to everything possible, whether it's skin, whether it's hair, things like that. But what you actually have to remember is that the hair is in a very, very delicate position in telogen effluvium, and you do not have to massage really hard for any kind of oil to penetrate, and it's not going to affect the hair fall. It's internal, it's not an external factor. Coconut oil is definitely not going to help you in post pregnancy hair loss. So be aware of all these superstitions that sometimes cause more danger. So the lot of women who've actually come after months of trying out a lot of scalp massages, and they pulled out the rest of their hair also. Even the delicate hair that is actually holding on a little bit carefully is also pulled out because of this act of roughly massaging. So don't do that. Eat a very healthy, nutritious diet. It should include a rainbow colored diet of fruits and vegetables. Now, what do I mean by a rainbow colored diet? It means all the bright colors of the rainbow should be included in your diet, whatever chart you make for yourself, whether it's protein, fruits, or vegetables. Make sure you include bright yellows, reds, oranges, and a lot of greens. Now, greens are usually the most iron containing products, as well as the brightly colored yellow, orange ones, whether it's citrus, grapes, oranges, apples, beetroot. All of these have a lot of antioxidants, namely carotenoids and flavonoids. So you have to eat a lot of brightly colored fruits and vegetables. So that's always very good. This is as far as diet is concerned. If you are vegetarian, you definitely have to check your vitamin B12 intake if you're deficient, if you're not deficient. But eat a lot of protein, you non-vegetarian people, eat a lot of lean meat. Chicken is always protein, it's good meat, it's white meat. The other thing that I always do as a dermatologist is you have to check values that the patient is deficient in. Pregnancy and childbirth in general does lead to a lot of bleeding, which in turn leads to a lot of loss of iron, even though you've been taking folic acid tablets for a while now. So, what you do have to do is up the vitamin intake in case you're deficient. What do we measure now? We measure vitamin D, vitamin B12, serum ferritin, as well as your thyroid profile. Needs to be just checked because you would have already gone through the entire thyroid profile assessment during your pregnancy itself. And if you are hypothyroid and you are already on Thyronorm or your hypothyroid medication, by all means, you have to continue it. But also follow up always with your endocrinologist, because by taking regular readings at regular or fixed intervals of time is the only way to actually assess whether it's going up, down, do you need a change in dosage, and things like that also need to be kept in mind. Now, what do we actually give as far as medication is concerned? It's more of a conservative treatment because it's paradoxical hair loss. The patient requires a lot of counseling as far as telling them not to worry, not to distress. Don't stress more because stress in turn causes even more hair loss. And there's no way I can measure it in like a blood test, right? Like if you're iron deficient, I'll know as long as I measure your serum ferritin. If you're low in vitamin D, we know what value you're going to get by just doing a blood test. And we know that it's also going to be, what do you say? Uh, Measurable in the blood work, but stress is not. So I really need the mothers not to stress, do whatever it takes, whether it is meditation that helps, whether it's getting help for postpartum depression. There's a lot of mothers who suffer depression and don't even realize it post delivery. In especially in our Indian culture, it's not given that much of an importance. It's in fact looked down upon to consult with a psychologist or a psychiatrist. And yeah, so figure out your stress levels, figure out what you're deficient in. Eat a nutritious diet. No scalp massages, no oil massages of any kind. And of course, depending on whether you're lactating, not lactating, you're just giving formula, The medications that I give can then be sort of prescribed to you. What do we give? We give supplements for whatever you're deficient in. And the second thing is biotin. The biotin works like magic. The other things that I really am fond of giving that seems to be working really well are procapil and hair growth peptides, such as solutions, foams, serums that you can apply on the scalp. They do get absorbed when applied correctly in the right intervals. Now, these hair growth peptides are very patient compliant and friendly. Number one, because it's only external, the patient mentally doesn't think that she's taking something inside, even though it's, just multivitamins that we give. The second point is that it's as simple as just spraying once or twice, daily. So always talk to your dermatologist. I give a combination of your diet, counseling, home conservative measures to be followed, um, a hair care regimen, as well as one supplement and a um, solution or a hair growth peptide formulation, which is an external application. So I have covered in very simple words in brief about everything to do with postpartum telogen effluvium or post-pregnancy hair loss. The causes, why it happens, how long it takes. You do not have to worry. Within 6 to 9 months, it naturally recovers and your scalp will thicken back up to normal with the right guidance. So do not stress at all the new mums. If you have any question and answers about what we just spoke about, I'm sure a lot of you have a lot of doubts. Please type them in our chat window or whatever method you're using to ask us questions, and I would be happy to answer them. So we've got our first question from Hema. Good evening. I delivered my baby last year, September. I'm facing excessive hair loss after delivery. How do I stop my hair fall and regrow the lost hair? So Hema, this is exactly what I was speaking about right now. You suffered from postpartum telogen effluvium. Now, if you look at the timeline, you delivered last September. It's almost been a year, exactly a year within September right now, ending. So you definitely need to check what's missing in the body, because if it had to recover naturally and your scalp should have thickened back to normal within 9 months, which is in July itself. Since it's not, you need to go ahead, visit a dermatologist. I would start by measuring certain levels of nutrients. You could be deficient in serum ferritin, vitamin B12, vitamin D, or thyroid profile. Like, for example, right, like your serum ferritin, many people think iron is hemoglobin. Yeah, it's not. Okay. Hemoglobin is not iron. Iron has a lot of components to it, which most people don't know about. So, serum ferritin is one of those components of iron that is very, it plays a major role in hair, and hence you have to measure something called serum ferritin. For example, you need to have above 75 of serum ferritin. So start off, Hema, by consulting, investigating why it's still not stopping, find out the root cause, correct the deficiencies, address the root cause. And I'm sure once you get the correct medication going, whether it's oral or topical, I'm sure you're weaning off the baby as well now, probably get stronger medication as well. Your hair should be recovering with the right medication very, very soon. So I hope that answers your question, Hema. So we have a next question from Padma. Okay. So, hi, I have a 1.5-year-old, a child who's been recently weaned from breast milk. My hair loss started 3 months post delivery and has not improved after weaning. I eat a balanced veg diet. What should I do? Again, Padma, same advice. It's been more than 9 months, definitely more than a year. Your child is 1.5. So, this goes into what is called chronic telogen effluvium. The normal cycle is called acute telogen effluvium, which is expected post delivery, recovers within 6 to 9 months. If your hair loss is continuing beyond the duration of 9 months, which is your duration, which is 1.5 years, you're definitely going into chronic telogen effluvium, which requires investigation and treatment. Now, you are a vegetarian, you claim you eat a balanced veg diet, but I'm pretty sure you're not getting enough B12, for which there are a lot of supplements as well. Please consult a dermatologist. get your investigations done. You can probably start off with, since you've already weaned off the baby, you can start off with supplements containing a majority of biotin. It requires at least about 10 mg of biotin, and anything to do with hair serums can be taken. Don't start off with the hair growth serums containing something called procapil. Um, and these should really help. Some of the serums are there's Mintop Pro, which stands for Procapil. There's Bontress, there's Polyserum, there's Creastin, there's Neoptide. There's a lot of hair growth serums which are exclusive. There's Proanagen, which are exclusively made for post-pregnancy hair loss as well. So yes, Padma can definitely start using these. So I have the next question here. Dear doctor, my wife is suffering from hair loss after delivery. It started 1 year after delivery and it's been 1 year and 4 months and still not controlled. Kindly advise. So Mr. Manjunath, your wife definitely requires to find out what is the root cause. Okay, because 1 year after delivery, hair loss starting is definitely not postpartum. There are different reasons. It could be other stress levels, could be other hormones, it could be deficiencies, it could be inherited genetic female pattern hair loss, which is why it's probably falling out. I don't know. I usually have to see the pattern in which it's falling as well, to sort of investigate and determine what kind of hair loss. And depending on that, the same investigations or slightly different investigations, including ruling out other hormonal deficiencies, can be done, Mr. Manjunath. So this would require a detailed consultation in the sense that I have to assess the root cause and then give the treatment. Just blurting out some tablet and some serum probably won't work in your wife's case. So yeah, it requires assessment, it requires investigation. We need to go to the root cause of it. So the next question is, hello, I am finding a lot of hair loss whenever I take a head bath and comb my hair. Please suggest how to avoid this and have thicker hair. Everybody wants thicker hair. Number one, role of genetics. Whether you have thin hair, thick hair, moderately thick hair, or very thin hair, first is determined by genetics. Only then comes into play how these genetics are modified by your hair routine, the products you use, what chemical treatments have you done to your hair, your keratin, cysteine, smoothing, how many times have you done it, what is your age, are you a teenager, are you going through some hormonal changes, do you have PCOS, are you coloring your hair? How long? What is the duration of the coloring of your hair? Since when has it, started falling? There's a lot of things. And also, this is the most common complaint that whenever you're having a head bath, you see hair loss. It's not actually true. It's just that when we have a head bath or you use conditioner, the already shed hair, which would have shed anyway when you're walking, running, sitting, or whatever, is all accumulated in the drain, and it's only usually visible to women because they have long hair, so it coils up. Men also lose the same amount of hair. It's just that it goes down the drain. For women, it does not. It forms like a ball on the drain. So you think that you're having more hair loss. So you're right. You might be having more hair loss, but it's not just when you wash your hair at all. Whatever has to shed will shed anyway. Hair washing definitely does not increase hair fall. So once you identify the root cause of this, you can definitely have thicker hair in the sense that whatever maximum potential your genetics carry, you can definitely have that kind of hair. Okay, so the next question is, hair loss increases day by day. Please tell me any shampoo, medicine oil will stop your hair loss. So unfortunately, there's no shampoo or hair oil that can stop hair loss. It's not been invented yet. Otherwise, everybody would be selling just that one hair oil. There would not be so many things in the market. So like I said, a hair loss is, so think about it this way, right? Hair loss is something that happens from inside you. When you see your hair falling out, it's from the root. You see the bulb at the end of it. What does that mean? It's an internal thing. It's an internal issue. As in, whatever nutrients you are having in your body are probably not adequate. Maybe you're stressing too much. Maybe there's something wrong with your scalp microcirculation. We have to investigate it, which is what I've been emphasizing. Investigate, investigate, investigate. First, find out why it's falling. Shampoo won't help it. Shampoo will determine whether the outside dead part of this hair which is called the hair shaft, whether it's shiny, dull, frizzy, smooth, is determined by your shampoo, not the amount of hair loss. That requires medication, sometimes internally as well as externally after the investigation. So I hope that has answered it. So next question is, how bad is postpartum hair loss? For some people, they don't even have it. For some people, it's not much. They hardly notice it because it's almost the same as what they used to lose every day. For some people, it's really, really bad, which is why the entity has been given its name, and is also, it tends to be very, very depressing. So that is basically the graves of postpartum hair loss. But I have personally not seen anybody go completely bald with postpartum hair loss. It's a transient, temporary thing which can be usually dealt with and taken care of and managed. The next question is, what do we eat to reduce hair fall immediately? Lots of iron. Eat lots of iron, anything that contains iron. I tell my patients, listen, Google iron rich foods, make a table, and eat one thing or two things every day. From green leafy vegetables, from spinach to broccoli to any kind of green leaves, also dry fruits, and a lot of iron rich food substances, whether organic or inorganic, can be consumed. Also, there's no one food that I can tell you to reduce hair fall immediately. I'm saying eat iron rich foods because majority of the cases that we see is the hair fall is there because they are iron deficient. Which is why I'm guessing that if you fall into the 90% of the population that is ferritin deficient, then iron helps them. That's why. What drink helps hair growth? I don't know. If you know, please tell me. Um, I don't know of any drink that helps hair growth right now, not invented as of 2021. Fruits, of course, I've told you, rainbow colored fruits and vegetables. So, brightly colored fruits and vegetables, which contain carotenoids and flavonoids, beta carotene, all these come under antioxidants to fight free radical damage, which is caused by basically environmental pollution, exposure, and all of these things. So, these can be eaten to combat that part of the free radical damage to hair. Well, Um, so I hope I answered most of your questions. Thank you all for joining. For more information, more videos, more tips and tricks on how to deal with being pregnant or being a mommy, please download the Baby Chakra app. You can always use my referral code, which is my name, Shravya, which is SRAVYA. And you can also follow us on Instagram on the Baby Chakra app. So, my takeaway message for you guys is to stress less, consult a dermatologist as early on as possible. Please don't wait and sit and think and make it worse and do your own oil massages and Google research and home remedies and then come at the end of the day when it's too late to a dermatologist. Okay, so be wise, be literate, act educated, and consult the right people because our job is just to deal with all of this. Thank you so much for joining. And I am Dr. Sravya Tipirneni. I am the consultant dermatocosmetologist and trichologist. I work at Manipal Hospitals and Columbia Asia Hospitals in Bangalore in Whitefield. You can follow me on Dr. Shravya Says on Instagram or Dr. Shravya Tipirneni on Facebook. You can find us online to book an appointment. You can go on to the Columbia Asia website. You can get access to me through there. So thank you for joining and see you soon. You can access me on Baby Chakra also because my profile is up there with contact numbers and access.